Patients are prone to improve oxygenation. In severe adult respiratory distress syndrome, proning has been shown to improve patient outcomes. For a list of the full contraindications and indications, refer to the RA Proning OWI. To prone a patient, it's important to plan before you enter the room. Prepare a team, including a person to manage the airway, a person to manage the lines, and 4 people to perform the turn. Protect the patient's eyes by placing polyvisc lubricant in the eyes and taping them closed. Turn off the patient's feeds and aspirate and spigot the NG tube. Protect their pressure areas, particularly their forehead and chin, with Mepitil. Secure the endotracheal tube with tape and ties. You must have emergency equipment available to deal with accidental extubation and hemodynamic instability. Take spare ECG dots, clean sheets, a slide sheet, pillows, and a head cushion into the room. When you enter the room, place the patient onto 100% oxygen, ensuring that the end-tidal CO2 is connected and working, and place all the lines and tubes to the midline with appropriate lengths of extensions. To perform the proning, place a slide sheet folded side towards the ventilator and a fresh sheet for levering widthways under the patient so that the fresh sheet edge is just overhanging the bed. Roll the patient again to pull the slide sheet and the levering sheet through under the patient. The patient should be slid away from the ventilator so their shoulder is at the edge of the bed. The bed should be levelled and the patient's gown removed. ECG dots should be removed so as not to create pressure areas. The patient's arms, particularly the arm over which they're going to roll, must be tucked under their buttocks with their palm up. Place 2 pillows on the patient's chest and 1 over the pelvis. Pass the levering sheet over the patient to the staff on the ventilator side. Staff on the ventilator side should grab the sheet palm up with one hand and push with their fist on the pillow at the level of the bed with the other. With clear instructions from the airway team member, the patient is turned to the lateral position. Check lines, the endotracheal tube, and end-tidal CO2. The levering sheet is then passed back to the staff on the other side from the ventilator. Staff on the ventilator side hold the pillow with one hand and the patient with the other, while staff on the other side of the ventilator pull on the sheet to pull and turn the patient prone. Turn the patient's head to their side and put their arm into the swimmer's position. Place a proning cushion under their head. Ensure their ears are not folded and their eyes are not under any pressure. Place ECG dots on their back. Ensure there is a pillow under their ankles and check that their genitals are not tensioned or twisted in males. You should tension the sheets to ensure there are no creases and check lines, the tube, and end-tidal. To deprone or to turn a patient supine, you simply need to reverse the process. So first of all, put the patient onto 100% oxygen. Remove the proning cushion from under their head and remove the ECG dots. Place the patient's arms at their side and slide the patient towards the ventilator. Place their hand under their hip with the palm facing up. Pass the levering sheet over the patient to the team on the non-ventilator side. Turn the patient to the lateral position. Then pass the levering sheet to the staff on the ventilator side. Check lines, check end-tidal CO2 and check the endotracheal tube. Then pull on the levering sheet to turn the patient supine. You should then reapply the ECG dots and check again the tension on your lines for end-tidal CO2 and the endotracheal tube.